Biacuplasty is a minimally invasive fluoroscopy-guided procedure used to treat chronic discogenic low back pain arising from a damaged intervertebral disc. It uses two internally cooled radiofrequency probes placed within the posterior annulus of the disc. Unlike conventional RF-cooled RF uses, sterile water continuously circulates through the probes via an inlet and outlet system, keeping the electrode tip cool while radiofrequency energy heats the surrounding tissue. This cooling prevents tissue charring at the electrode surface, allowing deeper energy penetration and creating a larger, more uniform therapeutic lesion than conventional radiofrequency. The controlled thermal energy denervates painful nerve endings, reduces inflammation, and promotes collagen remodeling within the annulus, helping relieve pain and improve spinal function in carefully selected patients. The patient is positioned prone on the fluoroscopy table. A true anteroposterior view is first obtained by squaring the end plates of the target vertebral level. The C-arm is then rotated to obtain an ipsilateral oblique view, opening the disc space and clearly visualizing the safe working corridor. The skin entry point is identified, and local anesthetic is infiltrated into the skin, subcutaneous tissue, and paraspinal muscles. Using the Kambin's triangle approach, the cooled radiofrequency introducer cannula is advanced just anterior to the superior articular process toward the posterolateral aspect of the intervertebral disc. The needle is advanced under continuous fluoroscopic guidance using alternating AP and lateral views until the tip reaches the posterior annulus at the desired position. The identical procedure is then repeated from the opposite side. A second cooled radiofrequency introducer cannula is advanced through the contralateral Kambin's triangle and positioned within the posterior annulus, creating a bipolar configuration across the posterior portion of the disc. Once both cannulas have been inserted, their positions are carefully confirmed in both anteroposterior and lateral fluoroscopic views. On the AP view, the cannulas should be symmetrically positioned on either side of the midline, while on the lateral view, both tips should lie within the posterior third of the intervertebral disc. After confirming satisfactory positioning, the cooled radiofrequency electrodes are inserted through the cannulas and connected to the cooling system and radiofrequency generator. A small amount of local anesthetic may be administered for patient comfort if required. The Biacuplasty lesion is then initiated. Continuous cooling is maintained while bipolar radiofrequency energy is delivered between the two electrodes for approximately 15 minutes with 50° as set temperature. The internally cooled electrodes allow controlled heating of the posterior annulus while minimizing excessive temperatures immediately adjacent to the probes, resulting in effective thermal modulation of the painful annular tissue. At the completion of the treatment cycle, the radiofrequency delivery is stopped, the probes are removed, followed by removal of both introducer cannulas. Hemostasis is achieved, sterile dressings are applied, and the patient is transferred for post-procedure observation. Thank you for watching this procedure. If you are passionate about interventional pain medicine and want to enhance your knowledge and procedural skills, I warmly invite you to ICRAPAN 2026, the 10th International Conference on Recent Advances in Pain, taking place from 4th to the 6th of September 2026 at Vedic Village Spa Resort, Kolkata, with pre-conference hands-on workshops on the 3rd of September. The conference theme is From Evidence to Practice, Shaping the Future of Pain Medicine. You'll have the opportunity to learn from internationally renowned faculty through expert lectures, live procedure demonstrations, hands-on workshops, musculoskeletal ultrasound sessions, fluoroscopy-guided interventions, regenerative pain medicine, and interactive case discussions. Whether you're a pain physician, anesthesiologist, physiatrist, orthopedist, neurologist, fellow, or trainee, this conference offers an outstanding platform to learn the latest evidence, refine your skills, exchange ideas, and network with colleagues from around the world. We look forward to welcoming you to Kolkata for an inspiring academic experience. See you at ICRAPAIN 2026.